Good afternoon.
Good afternoon, Madam Chair.
Today is Friday, March 20th. Happy spring. We have voting list number 15. We are in the Finance Committee. We're going to start with 3 bills that were jointly assigned that we were secondary on. And are you ready, Amber? We're going to start with Amber, Senate Bill 388.
Thank you. Okay, good afternoon. What we have before us to vote, Budget and Tax voted this morning is the Decade Act back from last year, Senate Bill 388. You do have a rather large reprint. I'm sorry it is not annotated because we already had the copies made and I wasn't annotating 10 copies. I apologize. Senate Bill 388 is an administration bill that, as introduced, alters various economic development programs and tax credits. The bill renames the Economic Development Opportunities Program Account, aka the Sunny Day Fund, to now be the Strategic Closing Fund, relocates the fund to the Department of Commerce, and makes various alterations to the fund. Alters various provisions relating to the Maryland Economic Development Assistance Authority, establishes the Maryland Small Business Development Financing Fund within the Department of Commerce. This is the successor fund to multiple funds, including the Small Business Development Contract Financing Fund, the Small Business Development Guarantee Fund, the Equity Participation Investment Incentive Program Fund, and the Small Business Surety Bond Fund. Extends the Job Creation Tax Credit Program by 5 years to January 1, 2032. Transfers the RISE Zone program and the Build Our Future grant program from Commerce to Medco, and also makes various alterations to those programs. Requires SDOT to waive the filing fee for a business entity that is in an eligible technology sector and located within a RISE Zone. The eligible technology sectors are advanced manufacturing, aerospace, agriculture, AI, biotech, blue technology, cybersecurity, defense, energy and sustainability, life sciences, quantum, and robotics.
Can I ask, Amber, what was the vote in the Budget and Tax Committee?
I believe it was unanimous with one person excused.
Can I get a motion favorable for Senate Bill 388?
Favorable.
Okay, we have actually Reedy and Kramer. Do we need a roll call vote? Okay. All in favor of Senate Bill 388? Unanimous vote with who's here?
Go.
Okay.
Go.
Lisa, can you take Senate Bill 777?
777 requires the Maryland Department of Labor to allocate money from the Hospital Employees Retraining Fund to the local Workforce Development Board in the affected county or region in the event of a hospital closing, delicensing, downsizing, or possible downsizing or merger. The bill alters the state's quick response program established under the Economic Stabilization Act to generally place more responsibility and requirements on local workforce development boards. The department must forward certain Economic Stabilization Act notices to the appropriate local workforce development board. The bill also incorporates local workforce development boards into certain provisions regarding the apprenticeship career training in our neighborhoods program. There are no amendments.
Any questions?
777.
Mounts, all in favor of Senate Bill 777? Unanimous vote. Thank you. Okay, Lisa.
947. Now that I've had more time to digest the bill more thoroughly, I have kind of a summary that might be easier to explain the sections that have not been repealed by Senator Hayes' amendment. As we discussed yesterday, there's a reprint of Senator Hayes' amendment that strikes the provision exempting the projects from MTA projects from procurement provisions, striking the $400,000 cap, and then striking the provisions about the quick take, which would be the constitutional amendment. So as the bill currently exists under Senator Hayes' amendment, The bill would still repeal the Baltimore Regional Transit Commission and instead establish two new bodies, the Board of Directors for Baltimore Core Transit Service and the Commuter Services Advisory Board. The Board of Directors for Baltimore Core Transit Service has 9 voting members, and their duties include approving major service plans, policies, and initiative for Baltimore Core Transit Service, provide advice on major project initiatives, appoint a deputy administrator of the MTA and consult in their removal, review and approve MTA's operating capital budget requests for Baltimore Core Transit Service, and establish a review timeline for budget approval, require an approval of 2/3 members on a decision to withdraw from a New Starts capital investment grant accepted into the engineering phase, to provide input and advocacy for Baltimore Core Transit Service, evaluate performance and measures of the MTA and Baltimore Core Transit Service, and issue written recommendations on future priorities, review and approve service change reports, updates to Central Maryland Regional Travel Plans and Capital Needs Inventory Report, and review plans to ensure coordination between local services and Baltimore Core Transit Service. The Commuter Advisory Board is 9 members, and its duties include providing guidance on MARC and commuter bus plans and policies, and to review and comment on major updates to those plans, to provide guidance on hiring and removal of the deputy administrator, and to review and comment on MTA's operating and capital budget requests for MARC and commuter bus services, and to establish a review timeline for budgetary approval. Finally, the bill authorizes up to 12 management positions at the Maryland Transportation Commission to operate and administer all state-owned transit facilities, and the Maryland Transportation Commission has the authorization to determine qualifications, appointments, compensation, and leave for those individuals.
Have any questions on this complicated 947?
Their second.
Just a cost question. So I'm looking at the fiscal note, but the fiscal note is obviously changing from the amendments. There's a study that has to be done, but you said something about 12 employees, or is it like 12 new employees, or is it just moving people from one entity to the other?
So, sorry. Oh gosh, my computer's doing weird things now. Okay, so the fiscal note, I know they were hiring new employees.
It's going to be voted on 2 years from now.
No, the constitutional amendments removed from the bill. That was the quick take provisions. That's okay. So I think those. So I think that those might be people already. It says the bill requires MTC to determine qualifications for up to 12 management positions, and depending on those determinations, Transportation Trust Fund expenditures may increase further, but they can't determine that without the experience under the bill. So I guess the fiscal note's not reflecting those 12 new people, but they might not necessarily be entirely new funding. It could
I
be
got you.
existing.
Okay, that's fine. I was just curious.
Ultimately, they think they'll save money, though.
Yeah, they said that they're expecting. Yeah.
Move for everybody.
Thank you. Second? Senator Brennan? Okay, Senator Hayes and Senator Brennan, should we call roll call? Senator Reed, should we do roll call? All in favor of Senate Bill 947?
Okay, now let's vote.
Okay, we're gonna, oh, I'm
Well,
sorry.
we're going to do Senator Reedy's bills because he's going to leave, so is that what you're starting?
Yes, ma'am. So we're moving on to page 2 and jumping down to the middle of the page, first starting with Senate Bill 707. So Senate Bill 707, as amended and shown in the reprint, defines the term danger to the life or safety of the individual or of others for provisions of law regarding the emergency evaluation of an individual with a mental disorder or the involuntary admission of an individual with a mental disorder to a facility. The term means that as a result of a mental disorder, there is a substantial risk based on recent and relevant conduct and in light of the individual's history that the individual will cause serious bodily harm to themselves or someone else, or be unable to provide for their own basic needs to such a degree as to create a substantial risk of serious bodily harm, illness, or death. So there are substantial amendments to the bill that are shown on page 2. These were, for the most part, offered cooperatively by Senators Reedy and Lamb, but there is one provision that is noted on line 13 where the amendments diverge. And so I will just very briefly walk through everything that's happening under the subsection C. So the first thing that you see is just sort of a reordering of the provisions so that as a result of a mental disorder is moved to the front of that definition there. The amendments strike the phrase whether or not the risk is imminent and replace it with based on conduct that is recent and relevant to the danger that the individual may present. Now, that was some consensus language that was first developed back in 2021 and put in by some advocates who originally opposed the bill. Another phrase, in line 3, the word recent is added, again, bringing the sort of time horizon that may be considered closer to the current time. And you will see that also in line 6, serious bodily harm to the individual or another is required as opposed to just bodily harm. And then for the final piece in subsection C that is at issue, deals with this language that talks about the individual being unable, except for reason of indigence, to provide for the individual's basic needs. The provision goes on to list a few, but where Senators Lamb and Reedy's amendments differ is that Senator Lamb has proposed that the serious illness or death be in the risk of serious illness or death be in the immediate future, while Senator Reedy is proposing the near future. Before the committee considers both of those options, I just want to point out also that the Senator Lamb has language that's shown on page 3 of 3 that requires a report by the Behavioral Health Administration regarding the use of petitions for emergency admission. So I think the members may want to discuss the use of immediate or near back on page 2. Madam Chair, Senator Reedy would like to.
Senator Reedy?
Thank you, Madam Chair, and I appreciate working with a number of the advocate groups. Thank you to the chair and to Nathan for working very hard with us on this bill, and to Senator Lamb, too. I would want to discuss this particular issue, but he's been working well with us as well to try to get to the right place. Advocates are really, that are supporting this bill, are just really concerned that we make sure we have the ability for there to be a good danger standard in our law. We're one of the few states that doesn't have it, a danger standard in law. But also that there be an ability to get someone help before the worst happens. I think trying to get to the right place, the reason I prefer near future to immediate future is just immediate can be interpreted interpreted as it's like they literally have the gun. They literally have the knife. They're right there. Near gives you it still says it can't be that, oh, I think in the next 6 months they're going to be harming themselves. But it does say near allows you to say it could be in the next few days, couple of weeks. That's how I look at it. On the other Senator Lamb amendment about the reporting, obviously have no objection to reporting, of course, so that's fine. But anyway.
Senator, we had some unfavorables, and you said you've worked with the advocates. Are we in better shape on the unfavorables now?
We are.
Okay.
We are. I'm struggling to pull up the entire list. We had Nathan. Do you have the?
Yeah, I can provide to the committee that some organizations who had signed up unfavorable have changed to neutral. I can say that the Mental Health Association seems to be in a neutral posture. I can say that Behavioral Health System Baltimore remains unfavorable. Civil Liberties Union and the Office of the Public Defender remain opposed to the bill, although did participate actively in helping to craft the revised language.
Some of this language they appreciated, even though they just philosophically have the disagreement.
I think it's an accurate statement about the position of the parties is that whether they participated or not and whether their suggestions were accepted or not, they were philosophically opposed to any legislation that could potentially increase the number of people subject to emergency petitions or involuntary admissions.
The advocacy side of it is that people want to be able to help their family members, and so we've been that's the challenge here. And we also know we got to be careful. We got to be careful with it. So anyway, yeah.
Senator Lamb?
Yeah, thank you. So I think this bill's gotten to a much better place than where it first started, and appreciate working with the sponsor and all the stakeholders on this. Just a little bit of context behind why the suggestion of immediate. It's really just a thought that when you look at some of the data and evidence out there, that the research shows that a lot of these psychiatrists or mental health providers, when you're trying to predict beyond like 3 months, it becomes very gray as to like how they can assess risk with any level of like firmness. And so, immediate was more kind of the near term. Well, I guess near is what you just used. Immediate is kind of closer, I guess, to the right. And so, I guess the thought here was that, the further out you go, the less good these providers are at being able to assess the risk of these individuals, right? So, you really want to just assess the risk in the closest term as possible, which is why immediate. But, both of these aren't super clearly defined, so,
Yeah. I mean, my press would be, if it's possible, to do near, if the committee's will is to do that. I feel like that gives a little more comfort to the advocates who wanted a much broader bill, which we have had to scale down, and I understand why. I appreciate it. I think getting a report is good because we'll know if this is being abused. We're going to find if there's a feeling this is being abused. I think we will find out pretty quickly. But I don't believe there's going to be a rush on this because I think we've fashioned it pretty narrowly. But I don't know where we go from here. Do I move my amendment to make it near, or how?
I'll make it easy. I'll take that as friendly, and we'll use your amendment. I'll defer to you.
I look forward to Senator Lamb being the floor leader. No, I'm just
Senator Hart, you have a question?
Thank you, Madam Chair. There's a survey in this bill, right?
There's a report.
Report, yeah, the report.
Yes.
Yeah. Who's the report go to?
The report is delivered to the General Assembly by the Behavioral Health Administration.
Thanks.
Thank you, Senator. Do I have a motion favorable with the word near?
I'll move favorable on the bill.
I'll second it.
Favorable with amendment with the word near, duty amounts. All in favor of Senate Bill?
Wait a minute. Quick question, if I may.
Sure, I don't see your light, I'm sorry.
Where's Senator Lamb on this?
I'm going to support my friend.
He just said that he would do near. Okay, I'm sorry. Okay, so now all in favor of Senate Bill as amended, including the word near? Can we
I
see?
am following the good senator's lead on
Okay, thank you. Unanimous vote, thank you.
All right.
We have one more for Senator Reedy.
That's correct. So the next bill then is Senate Bill 893, which as amended and shown in the reprint requires the Department of Health beginning in 2026 to conduct an in-state cost of dispensing survey for prescription drugs at least once every 3 years. The amendment that Senator Reedy is offering strikes the provisions that would have required the department to adopt regulations altering the dispensing fee based on the survey. So it effectively removes the automatic adoption of the change to the dispensing fee as a result of that survey conducted on every 3 years.
Senator Hayes?
Thank you, Madam Chair. I just want the record to reflect, if we're to pass this bill, this would be the first time in history that Reedy's gotten 2 bills passed in one bill.
Wow.
I think we should make history today. What do you think?
Move favorable.
I find that a little troubling.
Senator,
I have one question about my own bill, sorry. Of course, because of course I do. I did have a question from somebody who looked at the amendments and was curious. The report that we have in here, can it also go to the standing committees in the General Assembly? Oh, there you go.
Sure.
I hadn't even had a chance to look at the amendments really because we've been working on the fly. So, I mean, could we I know obviously the report's going to go to the, it's going to go to where we have in the bill, but if we could, if like finance and HGO could get the reports.
And the Health Committee, yes, yes.
Yep.
okay. So we had an amendment. Okay, now all in favor of the bill as amended?
Just quick question. I want to confirm that this actually raises fees and costs. I just wanted to confirm that.
As amended, it does not. As amended, it does not.
Do we know that for a fact? Do we have a revised fiscal note? All right, I'll vote, Madam Chair.
Okay. All in favor? Unanimous vote, thank you. Okay.
All right.
Senator Reedy, you can leave anytime now, it's 5:03. Are you leaving?
Two things that's never happened in the history of the Senate Finance Committee.
Senate Bill 496, you mean?
I'm fine if you want to get Senator Hurd.
How's out of order? Okay, is that, okay. Moving back then to the top of the list on page 2. This is Senate Bill 340. Senate Bill 340, as amended and shown in the reprint, requires the governor, beginning in fiscal year 2027, to include in the annual budget bill an appropriation of at least $2 million to support the Office of the Long-Term Care Ombudsman in the Department of Aging. And so the funds under the bill as amended are going to be drawn from a specified, a specified fund that receives remittances from managed care organizations that don't meet certain minimum loss ratio requirements. So if an MCO doesn't spend, I believe the number is 85% of the funding that they receive on patient care, then an assessment is leveled against them and it goes into this fund. So that is where the money will come from. Instead, you can see that language on page 4 of 4, the back page of the reprint. So then if the total amount of money in that fund is not sufficient to cover the mandated appropriation, then general funds are required to be used. And the funds appropriated under the bill are in addition to and are not intended to supplant existing funding.
I do have a question. How does this change the current ombudsman program where we have an ombudsman in every county and then the ombudsman? What changes here?
It makes no changes to the ombudsman program. It's just establishing additional specific funding moving forward.
A new one.
For what?
For the office. It makes no changes to the existing state long-term care ombudsman, but it provides additional funding that is in addition to and not supplanting any other funding. So it can allow that office to increase their activities.
Okay. Do I have a motion on Senate Bill 340 I'm sorry, Senator Jackson.
So is it funded, is this in the budget, you said it was 2 million or something?
So the remit, let me be specific. So the $2 million is drawn from that fund that I described related to the MCO minimum loss ratio. That fund has sufficient funds in it currently to fund this $2 million. In 4 of the last 5 fiscal years, it has had more than $2 million in the fund.
Okay, thank you.
Senator Mounts.
Just a quick question. So those funds that were used to leverage Medicaid funds, I'm reading the Department of Health letter of opposition to the bill.
Unless they've provided an updated letter, that is not the case. So the Department of Health letter on the bill as originally introduced affected Medicaid funds. The amendments strike that source of funding and instead use this MCO minimum loss ratio fund. It's a completely different funding source than the department was originally concerned with.
Okay, thank you.
Yes, sir.
Have any other questions for Senate Bill 340? Senator Jackson.
The fiscal notice says 5.3 million.
That's correct. So in the bill as introduced, it did not specify a mandated appropriation. It used a percentage of a different matter entirely. So if you look in the stricken language on page 2 of 4, it talks about at least 3% of the funds collected by the department under this section referring to the provisions stop.
Senator, you need the reprint. It's not updated online. So
Sorry.
So the fiscal and policy note has not been updated to reflect these amendments because the committee has not adopted them.
Okay.
Okay. All straight? Can I have a motion for Senate Bill 340? Please. Senator Guile, can I have a second? Senator Jackson? Okay, all in favor of Senate Bill 340? Everybody in favor? Yes. Okay, thank you. Unanimous vote. Thank you.
Up next is Senate Bill 489, which as amended and shown in the reprint authorizes the Board of Physicians beginning October 1st of 2028 to issue a limited license to practice medicine to a physician trained and licensed in a foreign country who meets specified requirements covered in the bill. The term of the limited license may not exceed 3 years and authorizes a holder to practice medicine only while employed full-time by a healthcare facility and in the employing healthcare facility or a related facility. So the bill also repeals an existing fifth pathway program for foreign trained physicians related to graduates of an international medical school. So the amendments strike the bill as introduced and then substitute the program that I've described. I'll just briefly point that on the what is the third physical page, it's unnumbered because of the reprint, is where at the bottom in subsection D, the qualifications section begins. The bill also specifically authorizes the board to find an applicant to be ineligible for a limited license under certain situations, such as if they were subject to previous disciplinary action in their country, the country where they were previously practicing. As I mentioned, the term of the license in subsection G is limited to 3 years, and the board may revoke the license if the licensee, for example, practices outside the scope of the limited license, which would be in any other facility other than the one in which they were employed. And then finally, uncodified language requires the Board of Physicians to consult with MedChi in the development of policies and regulations implementing the bill.
And is MedChi on board? Senator Lamb?
Yeah, so I appreciate all the stakeholders working on this. Yes, MedChi is on board, they're supportive. The Maryland Hospital Association is on board, they're supportive, and the board is supportive of this current posture as well. So there is no opposition. I know there's been a lot of effort to try to get to this language, so appreciate that. The gist of this is basically you have physicians that may be trained in like the Caribbean or European countries or other nations. They come here, but because they haven't done a residency here, it's really hard for them to be able to practice. Oftentimes, then they may be just doing research or teaching or doing academic stuff, and these are oftentimes doctors that have been fully trained elsewhere and have been practicing on their own. Other states have moved forward with trying to figure out a structure by which they could at least get, move towards the direction of getting a full license, and this helps with that too. So this is what that bill does, just to give everyone some background here.
Senator, I want to thank you. I think this is at least the third year we've had an international physician bill, and thank you for bringing everybody together and getting this done. So do I have a motion favorable?
Yeah, move favorable.
Can I add?
Sure.
Add Senator Young on as a co-sponsor to this?
Yes.
Okay, oh, because of her bill. Her
Yeah.
bill's not gonna, I'd like to be a co-sponsor too.
Me too. It's a good bill.
Senator
Got it.
Washington too? Okay.
Lewis, Young, A. Washington, Hayes, and Beidle. Great.
So we had a motion, I'm sorry, I forgot who motioned. Senator Mouts motioned, who seconded? Senator Lamb. All in favor of Senate Bill 489? Okay, thank you. All right, got a Hershey bill.
What's up next? Senate Bill 496, for which there are no amendments and therefore you have no reprint. The bill authorizes Medicaid beginning January 1, 2027 to provide comprehensive coverage for the treatment of obesity, including coverage for intensive behavioral therapy, bariatric surgery, and any medication approved by the FDA with an indication for chronic weight management in patients with obesity. Medicaid may undertake utilization management to determine medical necessity and appropriateness, and by November 1, 2027, MDH must report to specified committees on whether they have begun to provide the comprehensive coverage outlined in the bill. Again, there are no amendments.
Was there a fiscal note?
So the bill is only authorizing and therefore is not going to incur any additional costs.
Does it do anything?
I think the specific testimony that Senator Hershey provided in the bill hearing was that it sends a very strong message to Medicaid that it is the desire of the legislature that they cover this.
Email?
We can change, I would be happy with your amendment to change may to shall, if you would like.
Do we need a bill to send a message? It hurts, doesn't it?
Okay, do I have a motion for Senate Bill 496?
I will move favorable, Madam Chair.
Thank you.
Okay, and Senator Hershey? It's going to be funny because Senator Hershey's going to get up and Senator Reedy's going to get up and Senator Reedy's going to get all on your own bills. Okay,
Must probably have crossover.
okay.
I should have plenty of questions by the time it gets there.
All in favor of Senate Bill 496? Thank you.
At least for the sunset.
Unanimous vote. Okay.
So up next is Senate Bill 515, which, as amended and reflected in the reprint, authorizes the Health Services Cost Review Commission to consider all reasonable costs incurred on expenditures made by a hospital in connection with the operation of the facility, including costs to employ or contract with physicians or other professional providers for which the facility does not receive corresponding offsetting professional revenue. Currently, HSCRC does not consider physician costs. The commission, in coordination with specified agencies, must, by June 1st of 2027, report to specified committees on efforts to collect and analyze certain data and to develop and implement a policy to address the costs identified in the bill. And so the amendments add the required report. They authorize rather than require the commission to consider these specified costs and strike changes to the jurisdiction of the commission. The bill is no longer an emergency bill, taking effect June 1 of this year.
Any questions? Motion?
Move favorable.
Thank you, Senator Kramer and Senator Lamb. All in favor of Senate Bill 515? Senator Washington, Senator Gall, you okay? Okay, thank you.
Still have an E on that agenda there.
I know.
The agenda will not be updated to reflect the amendments until the amendments are adopted.
Got it.
Imagine that.
So, procedural hiccup there. I think the same thing happened with the constitutional amendment question. So next is Senate Bill 742, which, as amended and shown in the reprint before you, establishes additional requirements for waivers administered by the Developmental Disabilities Administration and codifies existing federal mandates related to the waivers. The Department of Health is generally prohibited from procedurally disenrolling an individual from Medicaid or home and community-based services based on missing documentation. The department must retroactively reinstate certain recipients who were procedurally disenrolled. Subject to federal approval, the department must reserve capacity in home and community-based services waivers for recipients who lost eligibility under certain circumstances. And beginning on January 1, 2027, the Department of Health must submit quarterly reports to the General Assembly regarding Medicaid recipients who receive certain services. So the amendments strike language requiring the continuation of services until all due process rights are exhausted and a final determination is issued. You can find that language stricken on page 5 of 7, was previously subsection F. The amendments further strike provisions prohibiting placing an individual on a waiting list or requiring a new application if the disenrollment was the fault of the department. And then finally, the amendments sunset the reporting requirements after 3 years.
So what does it do if it doesn't require continuation of services?
So the bill, as amended, would prohibit I think the primary benefit is that it would prohibit the procedural disenrollment and again codifies these other existing federal provisions. The amendments are offered by the sponsor of the bill, and There's other language. I'm trying to untangle the ones that are simply codifying federal requirements. So but let's see.
I bet every one of us have had a phone call from a family who's suddenly lost benefits.
Yeah.
And the
So
work that we have to go through to try to get them re-enrolled. So that's why I'm asking if it doesn't require continuation of benefits.
the retroactive reinstatement of benefits is a significant change, and then the additional specificity around procedural disenrollment is another significant change.
Okay. Can I have a motion favorable on Senate Bill 742 as amended? Senator Mounts, can I have a second?
Second,
Senator Kramer, all in favor of Senate Bill 742? Unanimous vote, thank you.
Next is Senate Bill 870, which, as amended and shown in the reprint, requires the Department of Health to submit 2 reports to the General Assembly by December 1st of this year. And so the first one generally examines adolescent psychiatric inpatient bed capacity by county, which must be submitted each year until 2030. And the second report, in consultation with specified entities, the department must address how to ensure the best possible outcomes for adolescents receiving inpatient psychiatric care and how to ensure that the correct services are provided to adolescents. The amendments strike provisions of the bill that were related to the establishment of a certain number of adolescent psychiatric inpatient beds, and then modifies the report about capacity, as I described, and then adds the report about outcomes.
Senator, were you going to move favorable? Okay. And then is there a second? Senator Kramer, you have a question,
Just
Senator?
a quick question. So the bill was amended to cover, it's originally Prince George's, but it's been amended to do the entire state?
So the provisions related to the establishing psychiatric beds in Prince George's County are removed. The report in the back calls for this information to be reported by county. It doesn't change the scope of that report.
By all counties?
Yes.
Okay.
Yeah, and then who gets a report? Does it goes to all the members of the General Assembly or the committees?
To the governor, and in accordance with the state government article, the General Assembly. So it'll be available through the DLS website, for
Gotcha.
example. Yeah.
And then when's the report done?
December 1st of this year.
Okay, thank you.
There was, if you saw in Maryland Matters this week, there was a vote from the Board of Public Works funding the beds. But, you know, where are the beds going to be? That's why this report, I think, is important. So it's become a very serious issue in the state, and we're finally funding it. Well, that's why the money, it was, what was, it was $1 billion, it was more than $1 billion. It's the staffing that's so expensive. But it's a good bill. So Senate Bill 870, do I have, can we take a vote? We have a motion and a second. Everybody favorable, Senate Bill 870, thank you. Unanimous vote. Okay.
All right, the last bill that I have for you today is Senate Bill 867, which requires a recovery resident, for which, thank you very much, 876, as amended and for which you have a reprint, requires that a recovery residence beginning June 1st, 2027, so that's the amendment changes from January 1, 2027 to June 1, 2027, that a recovery residence be certified by a credentialing entity approved by the Department of Health before operating in the state. The bill also updates reporting requirements for the credentialing entity such that it must submit an updated list of certified recovery residences to the department as necessary, and then the department must maintain a list of the credentialing entity and the certified recovery residences on their website. So again, the amendment just delays the requirement from January to June of 2027.
And there's not a fiscal note, the fiscal note was approved, or what's the fiscal note issue?
Budget and tax is fine with the bill as amended.
Okay.
What about NEH?
I don't have an updated number on the fiscal impact. I think that the department's general position about certifying all of them, remains unchanged. The moving out the requirement to be certified, I think, addresses some of the concerns, but not entirely.
Move favorable.
Thank you, Senator Hayes. Do I have a second?
I think Senator Mount.
Oh,
Okay.
sorry.
Okay. Second, do I have, okay.
Lamb has something.
Senator, okay.
Yeah, I just have a question about this, I guess, as background. I remember the hearing on this, and then, I guess from a public health perspective, always try to keep an eye out on things that might kind of run against federal statute. And I just had a question because the Federal Housing Act at the federal level prohibits discrimination on the basis of disability, and that includes physical or mental impairment, and any record of having such an impairment, being regarded as having such an impairment. This was passed by Congress back in the 80s. And, I guess the question here maybe for council is whether this would violate federal law because it applies just to housing that's intended for people who are in recovery from substance use disorders. Do we have the legal authority to regulate housing simply because people in it are in recovery or residing in a recovery? Just wanted to make sure that there's not an interference here with federal law and the Fair Housing Act.
So I am not aware of I'm not aware of anything that would suggest that this would run afoul of the Fair Housing Act. The reason is that certification is already occurring. It's just authorized. So a recovery residence is not required to be certified, but they may be certified. The Department of Health's, I think it's the BHA, is the credentialing entity. And so this just extends that requirement to be certified by the credentialing entity to all recovery residences. I don't think that my understanding of the certification requirements is that it's not specific to, for example, the location of the housing. That the credentialing, so if you look on page 3 of 4, it says that the credentialing entity shall establish certification requirements and a process to administer the application and certification. This is all current law. Establish and monitor and inspect the recovery residence and conduct on-site inspections and issue the certificate of compliance. So my understanding is that this is really related to health and safety concerns in the recovery residences that are not currently certified. And by extending the certification requirement to all, instead of making it optional, it would allow for improvement of the conditions.
So you think it would not run afoul of federal law, the Fair Housing Act, as?
I don't believe so. It's not establishing, for an example, a prohibition on establishing a recovery residence in a certain area, right? I mean, typically, where I have seen legislation that would run afoul of that, it would be establishing a 1 mile exclusion zone from a school, for example. But this isn't doing anything related to that.
There was no opposition to the bill.
There was no opposition. It was right.
That was the problem.
That's correct. So, to my knowledge, none of the testimony raised Fair Housing Act concerns or discrimination concerns either.
Thank you.
Okay. So Senator Hayes, your motion, do I have a second? Who seconded? Senator Washington, thank you. All in favor, or no, you said you wanted a roll call? Can we have a roll call, please?
Senate Bill 876, favorable with amendment. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
I think Senator Mounts wants to check to see what the Asphalt Contractors Association
Maybe.
had to say about, but yes.
Senator Kramer, yes. Senator Mounts.
After contacting them. These organizations take many shapes and sizes.
Yes, they
And
do.
then requiring a certification, I foresee, I don't want to hold the bill. If there were a chance to hold it, maybe it could get me to vote yes. I know that there'll be problems in my district, so I'm voting no. I understand the intent. I'm not against the intent. I know they're difficult operations to organize. They do a good job in my district, but I'm concerned some of them may not be able to be certified. So I'm a no.
And so if there's, I'm not going to argue with you, but I would say if there's health and safety issues, they probably need to update them in order to be certified, but I have you recorded as a no. Senator Jackson?
Yes.
Senator Washington?
Yes.
Senator Guile?
Yes.
Senator Lamb?
Yes.
Senator Hershey? All right, I vote yes, Madam Manager, so that's 7-2,
Yes.
passes. Thank you.
We're going to go back to the first page. There are 3 bills at the bottom on the first page with my name next to them, starting with Senate Bill 84, State Personnel Collective Bargaining for Graduate Assistance. Senate, well, there is an additional amendment that I should at least make clear to the committee and the public before we move on this. As you know, when this was on voting before, the bill generally authorizes collective bargaining at the University of Maryland College Park and the University of Maryland Baltimore County, including for a fellow or postdoctoral intern in a comparable position. There is an amendment that would delay the effective date by 2 years until July 1, 2028. It's being offered by the chair. You do have a reprint of that just to show the delayed effective date as well as the initial amendments that limited the bill to the 2 campuses.
We really need a bill that's going to take effect in 2028. How did you do that?
I did it.
No, I'm just teasing him. Thank you, Madam Chair. We appreciate you're showing fiscal responsibility.
It's the university's time to overcome the adjunct, the federal cuts. Yeah.
Raise their tuition.
Well,
We'll know whether they have to or not. Do you know? Do not look a gift horse in the mouth.
Senator Kramer will vote their tuition.
How many years of
That horse
responsibility?
got awfully skinny.
You should be saying, thank you, I'm finally
you,
getting my
Madam
bill
Chair.
through after 4
I'm
years.
seeing the ribs on that horse.
Senator Hayes, you want to, Tammy, you want to call the votes, please?
Senate Bill 84, favorable with amendment. Vice Chair Hayes?
Yes.
Yes. Senator Kramer?
Yes.
Yes. Senator Mounts?
No.
No. Senator Jackson? Pass. Senator Washington?
Yes.
Yes. Senator Guile? Yes. Senator Lamb?
Yes.
Yes. Senator Hershey?
Yes.
You almost had me with the No, thank you.
Senator Hershey, no. Senator Jackson?
He has to pass, he's,
Oh, he's
Yeah.
abstained?
Abstain.
so the chair is happy to be
Yes,
vote
she
number
is.
6.
Oh, wow.
Yes. 6-1.
Thank you, Madam Chair.
It was actually 6-2.
No, 6-2.
Oh,
Because the one abstention.
okay, but they both voted no.
6-4, 2 against, 1 abstention.
Oh, I missed it. 6-2.
Because he said 6-2, I'm like,
I know. I'm like, ugh.
that's what I heard too the first time. I heard that too. I was like, huh? 6-1?
I would not have voted for it if it wasn't for that 2 years. Okay, Amber, Senate Bill 932.
Senate Bill 455 is next, I believe, and then we'll. Senate Bill 455 establishes a transformational project financing program and related fund within the Department of Housing and Community Development. This is TIF financing, as we've discussed before. The fund in the program is to support state-supported development districts that have a transformational plan and for which the local governing body has approved a tax increment financing plan before July 1, 2035, and pledged certain real property tax increment revenues. A state-supported development district is eligible for an annual disbursement of net new state revenue, which includes income, sales and use tax, income tax, sales and use tax, and other tax revenue designated by the comptroller that is attributable to the state-supported development district as determined and certified by the comptroller. That money then has to be deposited in the established special fund for the life of the local bonds, but not to exceed 30 years after the state-supported development district is completed. There is a reprint. It has additional amendments added, offered by the vice chair from what you saw yesterday, so I'll walk through the reprint. The first change we discussed yesterday, the Department of Housing and Community Development will administer the program rather than Medco. The next amendment is at page 5 of the bill at line 20. This changes from 2031 till 2035, the time for filing your tax increment financing plan with GHGD to establish the state-supported development district. So just, it's giving the districts a little more time to come up with that application and submit it. On page 6 at line 11, this changes the priority of consideration for administering approvals. Rather than the number and quality of applications being at the same level of approval as ensuring that the state-supported development districts are have varied population size and geographic locations across the state.
Amber, if
Sure.
I may just real fast. Are you going back over the existing amendments, or these just came in?
These are new amendments that came in today from Vice Chair Hayes. The only existing amendment that was on the bill was swapping out the Department of Housing and Community Development for Medco. These new amendments make substantive changes to the actual program.
And this is the TIF.
This is the TIF.
My only concern is, if I may, just real fast, and that's fine, we'll keep going through. Montgomery County government has 4 projects that they just wanted to make sure would not be harmed by anything done in the bill. And they had seen the amendments as of yesterday and said, okay, everything was fine. I'm just not sure what we do. I don't want to do, because they've got 4 projects already that they don't want to jeopardize.
I'll defer to Senator Hayes.
In order for them to take advantage of this would have to go through their local government. So their city council and everyone would have to approve a plan in order for them to take advantage of this.
Okay.
Right. So it
So there
doesn't
shouldn't
force
be
it.
anything in here that's going to cause.
Yeah.
There's no requirement that they
There's no
use a
requirement
TIF
that
or
they use it.
participate in this program.
Okay.
It's voluntary and would have
They
to
would
be
have to say,
determined
"Hey,
by
we
the
wanna do it."
political subdivision. Okay, still on page 6 at line 11, this is just changing the priority to make sure that the number and quality of the applications received are accounted for first, and then the department will from there afterwards ensure the varied population size and geographic location. On page 7, this is more of a technical amendment. It just authorizes administrative costs to go to an administrative cost account. And at page 9, there is an authorization to use cross-collateralization when a state-supported development district is contiguous to another development district. And on bill page 10, there's an additional requirement for the comptroller to adopt regulations, including the methodology used to derive the displacement adjustment percentages and what those displacement adjustment percentages are, including revised percentages. And this is to ensure that the comptroller must have public input for the displacement adjustment percentages before they are adopted. So going through the regulatory process ensures that. And then the final amendment on the bill is at page 12, which delays the effective date to July of 2027. This was requested by the comptrollers, being offered by Senator Hayes, just to give them enough time to implement what they've described as a rather complex build-out for sales and use tax to be able to distribute them the way the bill envisions.
Do you have any questions on Senate Bill 4?
55 is amended.
I also have a question, an answer for Senator Hayes if he wants it. In the bill, it does specify that it would be the Baltimore mayor and the city council.
Yes, I got that answer yesterday.
Yeah.
Move favorable.
Thank you, Senator Hayes. Do I have a second? Senator Washington, all in favor of Senate Bill 455 as amended?
Hope so.
Okay. It's good. It's good economic development.
It is.
All right.
Okay, now we
Now,
have,
Senate Bill 932. Senate Bill 932 generally requires a person that operates a social media platform to display to the state user the general geographic location of each user whose account is visible to the state user on the social media platform. The general geographic location means the city and country derived from the Internet Protocol, also known as IP address of the network connection through which a user's device accesses the social media platform. A person that operates a social media platform, however, may not display the general geographic location of a user that the person knows or has reason to know is a minor. A violation of the bill is an unfair, abusive, or deceptive trade practice under the Maryland Consumer Protection Act, and it's subject to the civil penalty provisions only with enforcement by the Office of the Attorney General. There's no private right of action or criminal penalties in the bill. There is an amendment offered by the bill sponsor, so you have a reprint. It's on page 2, and it simply is changing or altering the definition of social media platform. The definition's being amended to model more closely the definition used in Virginia's comprehensive privacy law.
Senator Washington?
Chair, I mean, I know we're not going to do private rights of action, but it looks like, I'm not sure if the bill, when there's, I'm looking at bill page 3 of 3, lines 10 through 15.
Yes.
Are we removing the criminal?
Correct. So,
aspects?
yes, this says they're subject to the enforcement and penalty provisions of the title, except for 13407 and 13408, both of which provide for private rights of action, and 13411, which is the criminal penalties. So those are all not applicable to the bill.
So then what's the penalty?
Yes, it would be through the Consumer Protection Division of the Office of the Attorney General. You make a consumer protection complaint, as we discussed before about how that process works. You make a complaint to the Consumer Protection Division. They reach out and then first must negotiate, try to resolve a settlement, and can proceed from there.
We talked about this yesterday, and many times during this committee that the Attorney General's office keeps saying to us they don't have enough people or staff to be able to do this, but we don't have. This doesn't provide any real teeth to make sure that these.
He does get a lot of money, though.
For these platforms, I mean, this is a serious issue, right? I mean, we're talking about people. We're talking about the platform putting out someone's location of where they are and displaying it to other social media users and knowing where folks are. And I think this is a good bill, but they can continue to violate this and there's no consequence at all. They'll just ignore it without any real consequence. So I think we should.
they could have real consequence if Consumer Protection will enforce it.
Correct.
Senator, if we put private right of action on it, it'll fail. I can tell you, because we're just saying someone does something on the internet and we're going to let you individually sue. That's what private right of action is.
Yeah.
And you know what happens? It's a pile on.
Yeah, I hear you.
Senator,
No, I hear you. I was gonna. I mean, but there's nothing else like a fine or we're taking out jail time.
that's what Consumer Protection can find.
Under the Consumer Protection Act, there are other penalty provisions. Yeah.
Say it again. Can you repeat that?
Including treble damages.
Yeah. What's that?
Means you get a lot more than what you what your damages would otherwise be.
rather than actual damages.
Yeah, there are real consequences under the Consumer Protection Act. I'm sorry. There are real consequences under the Consumer Protection Act. Whether or not the Office of Attorney General actually does something about it is a different question, I think, than what you're asking. But there are indeed, under the statute, existing penalties.
Yeah, I mean, I think some of this is great to have the Consumer Protection Division. What's not great is every bill that comes in here that we don't want to have these private rights of action, that we divert it back to the Attorney General, and we don't give the Attorney General enough, staff.
He's got a lot.
Well, I think that he needs more, and so we can enforce these, because a lot of this stuff comes up and ends up coming up in my district, and they ask me why doesn't this go any further, or how come the Attorney General isn't helping me, or I can't seem to resolve this issue. And so I just hope in the future, this committee, we can reconsider what we're doing when it comes to these types of bills. Thank you.
Senator Hershey.
Thank you, Madam Chair. Just, again, on the amendment, it defines a new definition for social media platform.
Yes, the intent is the definition to be more narrow than the bill as introduced. I'm sorry, I cut you off.
No, I'm sorry. You just mentioned that was used in Virginia, so could you
yes.
just tell me what that is, or tell us?
Sure. So there, in Virginia's comprehensive privacy law, like our MODPA that Maryland passed, they have a definition for social media platform. This is a narrower definition than what was introduced, and it models after that definition to just be more in line across states.
Across other states?
Yeah.
Okay, I think, so you would say then we're not doing anything relatively different than what other states are doing. We're more in line with what other states are doing. Is that?
I would say that no other U.S. states currently do this. The trend has been to limit data disclosure as opposed to requiring the disclosure.
Madam Chair, have we held this yet?
We're not holding it now, I'm afraid.
Okay.
It's today or it doesn't get through before possible. So I was asked to. Senator Mattson?
Yeah, are there any exemptions or exclusions for vulnerable people? Because vulnerable people, I mean, is there anything?
There's no definition of that in the bill, and they are not excluded from the bill. The only people excluded are minors or someone that the social media platform should know is a minor.
Yeah, I know we're short on time. I just think that the bill, I understand what they're getting at with the bill. However, I just think it needs more work. There's a lot of potential consequences, negative ones.
Favorable.
Senator Jackson, let's take a roll call.
Senate Bill 932, favorable with amendment. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Mount.
No for the asphalt.
No. Senator Jackson. Yes. Senator Washington. Yes. Senator Guile.
There it is.
Yep.
Yes. Senator Lamb. Yes. Senator Hershey.
I appreciate the limited definition, but I don't like doing things that other states haven't done yet, so, no.
Senator
You're not a
Hershey, no.
leader.
Madam Chair.
Yes.
You are a sheep. You're a
I've seen
follower.
a leader in bad policy, but I'm gonna.
7-2 passes.
No goodness, and I thought you were gonna be governor.
I was going bad policy.
Okay, we've got, I don't know, 50 minutes. If we can look on the third page, and we're going to start at the bottom with Senator Guile, Senate Bill 890.
Your mic.
Senate Bill
She's getting
Senate Bill 890, as amended, requires a captive insurer of a nonprofit health system to pay a premium receipt tax of 3% of gross premiums on reinsurance purchased by the captive insurer. If the captive insurer does not pay the specified premium receipt tax, the nonprofit health system is required to. The bill establishes a penalty of 25% of the tax due and an additional 1% for each month the payment is late. The bill also prohibits the Maryland Insurance Administration from charging or collecting a premium receipts tax subject to the Act that would have been otherwise payable prior to the effective date of the Act. There are two amendments. Amendment 1 is technical, and Amendment 2 amends the bill as specified. And MIA and MHA were both involved in developing these amendments.
Okay. Do we have Senator Hershey?
Thank you. So I'm trying to understand, because we pulled out in the title the word exemptions, but yet it still looks as though in section 2 of the bill that there still is an exemption provided. Is that?
Yeah, so the bill as originally introduced, I think, was applying the receipt tax to all of the money that the nonprofit health systems are putting into their captive, and that money may or may not be used to actually purchase insurance. So they amended the bill so it would only be paying the tax if they use money in their captive to purchase a reinsurance policy.
Okay, but it looks like, so to section 2, is that saying that anything paid, what about, so I guess my question is, what if fees were, or taxes were not paid prior to the effective date of this bill?
So for those would be wiped away. I think there was some dispute with MIA about whether those were actually, whether nonprofit health systems were exempt from that requirement or not to begin with. So I don't think there's been a real decision on that, but this would say, no, they have to pay that going forward on that reinsurance amount, but anything that could have potentially been done in the past, they don't have to pay. Is that correct?
That, I mean, to me, appears like quite an exemption. You know, again, in taking this out. I think what I was concerned is I thought that there were a number of companies that have paid this tax.
So what's difficult about captive insurers specifically is they're a wholly owned subsidiary of the company that has it. So MIA doesn't really have a registration of all the ones that exist, and the companies are kind of on honor systems to be paying their taxes.
Right.
And so this isn't really exempting them, it's just clarifying like what they're supposed to pay and how much.
Okay, but what if companies had been paying this, other companies outside of healthcare, where we redefined it now, nonprofit health systems, what if other companies had paid this tax for other reasons?
That wouldn't affect them at all because the uncodified language in the end that exempts the nonprofit hospitals, it only applies to a person subject to the premium receipt tax under 4-211.2.
That's nonprofit health systems.
Yeah, and that only refers to the nonprofit health systems.
But this part, section 2, that's the exemption. That's saying if you had failed to pay this in the past, that as of the effective date, you're no longer responsible for it, right?
Only if you were someone, only in a situation that's subject to 4-211.2. So only for the nonprofit health systems. If another company has a captive, this doesn't change anything in regards to what they've owed in the past or what they owe in the future.
But that's what I mean. It seems like it's making a new criteria just for the nonprofit health systems.
I think there was already some provisions in law, and it was just MIA and the hospitals were kind of coming to come to a clear understanding of whether they were exempt or not.
This was looked at in 2013 and continued to be where the nonprofit hospitals did not need to pay since 2013. So this isn't the first time we've looked at this issue as a state.
Then I'm just trying to wonder why, to be honest, then why is this a question? Why is it being brought up now? If it had, it seems like it has not been clarified, that there has been differing opinions on this, and the hospitals had decided, okay, we're not going to pay this tax. But I understand other nonprofits have been paying the tax. So.
Not all.
Not all, but.
There were even some for-profits that weren't paying the tax.
Correct. So, you know, what is happening with them? If I mean, are we doing this just to give a break to the hospitals and say, okay, you haven't been paying it, and so now we're going to change the law and say you don't have to pay it? Wipe the slate clean?
Well, they're going to pay it going forward, right? Doesn't the bill say they pay it going forward? Yeah.
Well, then to me, that means that they should have been paying it back.
But they weren't required to. The MIA, like I said, since 2013 has looked at this and they've never required it. What has happened, I think, is there's just been some pressure for some people, from some people that have looked into it, to say you need to review it again, and MIA has, and they said going forward, the hospitals will pay.
Right, but
It really should be the sponsor of the bill.
That's accurate.
Okay.
But that means that some nonprofits have been paying it. And so if you as a nonprofit decided, hey, this does apply to me, I've been paying this all along, then you've paid all that taxes. If you as a hospital said, well, we're getting advice that we don't have to pay it, they didn't pay it, and now the law is saying, actually, you should have been paying it, but they're getting their slate wiped clean because they made a decision not to pay it, where other companies have been paying it.
I don't know who those companies are that have been paying it.
No, I was just gonna say, I mean, I don't know exactly which companies or but by nonprofits, which have been. I mean, I think there was some lack of clarity as to whether or not what the obligation was. And I guess I would have to, I don't know if MIA as to what nonprofits have been or who owe what. But ultimately, I think this is also to some extent, like we pointed out, like a policy decision about our hospitals too.
I mean, I'm guessing some of this dispute comes from the fact that, is that they're required to pay premium receipts on insurance they buy from an unauthorized insurer, but if they're creating a captive that's basically their own subsidiary and isn't purchasing insurance from anywhere, I think that's where the confusion comes from as to whether they're obligated to pay that or not.
Right.
Right. All right, well, good day to be a hospital system then.
Okay, Senator Hayes, move favorable. We have a second? Yes. Senator Guile has a second. I think you need to call the roll, Tammy.
Senate Bill 890, favorable with amendment. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Mounts. No. Senator Jackson. Yes. Senator Washington.
Yes.
Yes. Senator Guile.
Yes.
Yes. Senator Lamb. Yes. Senator Hershey. No. Madam Chair.
Yes.
Yes. 7-2, bill passes.
Okay. Where are we going next?
Just start at the top, I guess.
Okay, we're going to take Senate Bill 435, Senator Folden's bill.
Senate Bill 435, as amended, establishes methadomasine and xylazine as Scheduled 3 controlled dangerous substances under the Maryland Controlled Dangerous Substances Act. There are two amendments. Amendment 1 is technical, and Amendment 2 strikes the bills and amends it as specified.
Which, we talked about this yesterday. So it makes it a criminal. And
Pass. Next bill.
if we don't have a motion favorable, we're just going to move on then. I don't see a motion favorable. Okay, Senate Bill 623.
Okay, round 4 of the cigar bill.
Let's do 831.
Yeah, I was going to say, maybe we should wait.
Tell us how you really feel, Lisa. Tell us.
I want to come in Saturday and talk about it more.
No, you're not. You can talk to an empty room on Saturday.
We'll be talking to a padded room soon. Okay. Senate Bill 831 prohibits a unit in the executive branch from petitioning or applying to the federal government for a waiver of any Fair Labor Standards Act provision that is applicable to the unit. It also prohibits employers from forming specified employee involvement organizations that are not subject to the National Relations Act or under the jurisdiction of the National Labor Relations Board. The last portion of the bill is amended somewhat by the amendments that were put in by the president, and those amendments the bill has passed the House committee with the same amendments. The president's amendments make the final provisions of the bill contingent on the Federal National Labor Relations Act being entirely repealed or rendered null and void, or the National Labor Relations Board expressly ceding jurisdiction to the state. And so the provisions that are contingent on that would allow a private employee in the state to have certain collective bargaining rights, and they can enforce those using the PERB, that's normally for public workers. And then they're also allowed to petition the board for certain other reasons, such as finding an exclusive representative for collective bargaining and making a decision on unfair labor practices, ordering employees to submit to arbitration, and allows the board to impose civil penalties.
I have a motion favorable from Senator Hayes. Do I have a second? Senator Kramer? Should we call a roll, or are we okay? Everybody in favor of 831? The President's bill? Did you vote, Senator Hayes, or do you want to call the roll?
Senator Hershey.
I mean, Senator Hershey. Started with an H. That was close.
President's bill?
Do you, okay, thank you. Unanimous vote. Okay, now we're gonna have the fun.
All right. Actually, Madam Chair, rather than reread the whole, unless something dramatic changed between yesterday and today.
Okay.
Can I simply say, I have an amendment, the chair has a letter from the delegation on an unanimous vote, and just offer the amendment? I believe there may be another amendment. There is not another amendment.
No. Move the bill as amended.
Wait a minute, we want this amendment.
Yes.
This amendment excludes Montgomery County.
Yes.
Does everybody agree? We've got a
Yes.
letter? Okay, so we're excluding Montgomery County. Is there another amendment?
No, not from me.
No, no more.
To clarify, is Montgomery County being excluded from just issuing the new CPCL licenses that allow the sale, or are they being excluded from all of the on-site consumption as well?
We're out of.
The whole bill?
consumption. We're out of the bill.
The whole bill?
Yeah.
Okay.
Out of the whole bill, and you should, if it was drafted properly, I don't know, but that was the request to. the
Because you have
amendment.
none of these operating in Montgomery County, right? There's none operating, and they're not going to give a license to anyone to operate like this, so they're
That's
done.
the point.
They'll be back next year.
We're gonna vote the amendment though, right?
Pardon me?
Will we vote the amendment?
Or we can vote the amended bill. That's what we usually
Wanna
do.
vote specifically?
I would vote for the bill, but I would vote against it.
Okay, then let's vote for the amendment. Senator Kramer, you want to make the motion to exclude Montgomery County?
I move an amendment, Madam Chair, that I believe is in the possession of the committee, as supported unanimously by the Montgomery County Senate delegation, to not have the bill be applicable to Montgomery County.
Second.
And we have a second. Senator Kramer, Senator Hayes, let's take the roll call on the amendment excluding.
Let's get this thing going.
Just to be clear, the amendment, this is a statewide bill that one county is asking to be exempt from.
That is correct.
All right, just, I appreciate the
It's
press.
actually the Republic of Montgomery County.
The People's Republic.
Yes.
All right, Tammy, I think you need to call the roll.
Okay, on the motion on Senate Bill 623.
Amendment.
Amendment, thank you, on the amendment on 623. Vice Chair Hayes?
Yes.
Yes. Senator Kramer?
Yes.
Yes. Senator Mouse?
Pass.
Pass. Senator Jackson?
Yes.
And you can't have our licenses.
Senator Washington? Yes. Senator Guile?
Yep.
Yes. Senator Lamb? Yes. Senator Hershey?
I don't like it, but if we're setting a precedent that we can now start exempting our counties from different pieces of legislation.
Wonk, 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 wonk,
Senator
wonk.
Jackson, how did you vote?
Yes, for the.
Okay, I didn't hear you.
Did Senator Mouse vote?
He
He
passed.
passed.
He passed.
It's coming back around to.
Oh, okay.
So Senator Hershey is a yes.
Wasted the committee's time, my apologies, I'll vote yes.
Senator Mouse, yes.
They're setting precedent here.
Okay, so now
Good for us.
10-0 to exclude Montgomery
The
County.
precedent expires on April the 13th.
You know what somebody said? Do you know what somebody said about our committee yesterday? We were always so boring and everything here always ran so calmly. Somebody told me they needed popcorn to come to our committee meetings. Thank you all for ruining my last session.
All of his floor amendments, I just could be accepting.
Move the bill as amended.
Okay.
Accept them out.
Senator Hayes just made a motion to move the bill as
There is
amended.
one provision that needs
Oh,
to
one
be
more.
amended.
Right.
Sorry, that's okay. I did get a message from the Attorney General's office that some of the language we had put in. You can't exclude Montgomery County. No.
Right. Come on, let's.
So we had said that a local licensing board should consider minority business enterprise participation, and they were worried that that is a constitutional issue. So if we can just remove that one, but leave the rest of the criteria, as long as the criteria is not referencing a protected class such as race, should be okay. And then the other language we added in was just to clarify that the boards could use their license, the powers they have, such as to suspend a license, revoke a license, and any other enforcement powers. So we added that language into both the CPCL and the BYO.
Where's that in the bill?
That on page 3 of 5, where it says it at the top, at the bottom, it says, if based on the annual submission required under this subsection or any other information available to the local licensing board, the local licensing board determines that a license holder does not meet the requirements of a tobacconist under 16.5-101 of the business regulation article, the local licensing board may revoke or suspend the Class CPCL or otherwise discipline the license
That
holder.
answers Senator Washington's question. Senator Hayes, you have a question?
Yeah, although the Attorney General recommended that we take out the protective class, did they make a alternative suggestion about like a disadvantaged community or anything, or they just recommended that we eliminate that language?
I can forward you their email that has a bit more detail in there. I think it's just because it's a race-conscious measure that would put it at a strict scrutiny standard, yeah.
No, I know.
But
and
yeah,
we've been doing
have to.
that with a lot of stuff, but there's been some accepted substitutes. I don't want to hold up the bill any more than what we already have. I was just curious if they offered any.
We would have to do a disparity study in the state.
Gotcha.
Yeah.
Okay, great. Let's go.
Senator Washington?
Amendment, I'm not sure if you mentioned it, Lisa, but it was about the gradual increase.
Yeah, so that's on page 2 of 5. A local licensing board may not issue more than 2 new Class C PCL licenses in a single jurisdiction during a calendar year.
Perfect, thank you.
Perfect. Got any other questions, complaints, comments? Okay. Can I have a motion for the bill as amended? Did you say, Senator Washington, did you say you motioned?
Oh, no.
You did not.
I motioned to
Oh,
move as amended.
you did. To Senator Hayes? Senator Mounts? Okay. Let's call the roll.
Okay, Senate Bill 623, favorable with amendment. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
You got your way.
Yes.
Yes. Senator Mounts.
Yes.
Yes. Senator Jackson.
Yes.
Yes. Senator Washington.
Yes.
Yes. Senator Guile.
Yes.
Yes. Senator Lamb.
I would like to explain my vote. So a few things. One, I did touch base with the chair of Budget and Tax. The location that he went to actually does not serve alcohol. So it does not serve alcohol. We, in Howard County, and I did finally hear back from the liquor board director, Howard County does not have any cigar lounges that serve alcohol. So the location that he was at, which he was last at 3 years ago, did not have alcohol, was also not BYOB. I did want to thank the efforts of the work group. I know the department had put a lot of time into this. Also, the sponsor of this bill worked very closely with the sponsor quite a bit, and so appreciate all the work that he's put into it as well, and the work group that MDH had over 2 years worked towards this. So I want to just express my appreciation for all their efforts as well. But my vote is a no.
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 You remember the work group.
Yes, a lot of meetings on that work group.
All right. Senator Hershey?
Yeah.
Yes.
Senator Hershey, yes. Madam Chair?
Yes.
Yes. 8-1.
8-1. And that ends our voting sessions before cross.